If you have been diagnosed with Lyme disease and you also deal with chronic migraines, I want to talk to you today about the mistake that I see most women make the moment they get that diagnosis. They put the migraine relief on hold. They tell themselves, I need to get the Lyme under control first. Then I can work on the migraines. It feels like the logical, responsible thing to do. You have an active infection. You have a treatment protocol. You want to focus. But here's what I have watched happen to woman after woman who takes that approach. They spend months, more likely years, focused exclusively on the Lyme while the migraines continue. That inflammation load stays high. The nervous system stays sensitized. And the body has a harder and harder time responding to treatment because the systemic inflammation is working against the healing process. So, what if I told you that working on your migraine root cause and working on your Lyme recovery, they're not two separate things pulling in opposite directions? What if they're actually the same thing? And doing both simultaneously makes the Lyme treatment more effective, not less. Now, that is what this episode is about. We know that Lyme disease is caused by a bacterium, right? But here's what most people do not fully understand about what this bacteria does once it's inside the body. Lyme is what researchers call a stealth pathogen. It is designed to evade the immune system. It can change forms, it can hide in tissue, and it can cross the blood-brain barrier, the protective layer that is supposed to keep the infection out of the brain and nervous system. Lyme bacteria are very good at getting through it. And when they don't just cause infection in the brain. They trigger this profound inflammatory response throughout the nervous system. They release what are called pro-inflammatory cytokines. So think of these as the body's alarm chemicals. And when those alarm chemicals stay elevated in the nervous system over a sustained period of time, they sensitize the trigeminal nerve, the main nerve pathway involved in migraine pain. This is not a coincidence or a random side effect. This is a direct biological mechanism. The bacteria gets into the nervous system. It triggers inflammation. That inflammation sensitizes the pain pathway. And chronic migraines, they're the result. Now, there was research that was published in 2024. It confirmed that Lyme disease can affect nearly any cranial nerve and cause a wide range of headache symptoms. There is documented evidence of women who develop a chronic migraine-like syndrome specifically following neurological Lyme. Migraines that do not resolve with standard migraine treatment alone. Now, here's why this matters so much for how you approach treatment. When Lyme is driving or amplifying your migraines, standard migraine treatments like triptans, preventatives, even Botox, they are working downstream. They are managing a symptom that has an active upstream driver. Now, those things might give you some relief in the moment, but they're not touching the root. Dr. Daniel Cameron, who is a Lyme disease clinician with over 30 years of experience, he has documented this in his clinical work. Headaches that do not follow the usual rules, that do not improve with migraine protocols, that persist throughout treatment. They're not a mysterious migraine. They are migraines with a specific inflammatory driver that needs to be addressed at a different level. Dr. Mark Hyman describes chronic Lyme as requiring a comprehensive approach, not just antibiotic treatment alone, but addressing gut health, getting inflammation down, supporting the immune system, and getting the body into a state where it can actually fight the infection effectively. His framing is you have to fix the soil, not just kill the pathogen. And Chris Kresser, who's written extensively on Lyme, puts it this way: antibiotics alone do not correct the immune dysfunction, inflammation, and metabolic disruption caused by the disease. You need anti-inflammatory support running alongside treatment, not after, but alongside. So let me tell you what this mistake looks like in real life. We have someone, maybe you get diagnosed with Lyme. You start a treatment protocol. You mention your migraines to your doctor, and your doctor says something like, let's focus on the Lyme for now and see if the migraines improve on their own. Sometimes they improve a little, but usually they do not improve the way that you hope. Because Lyme treatment, whether it's antibiotics or herbal antimicrobials, is targeting the pathogen. It's not addressing the six inducers that were already kind of fueling the migraine, and really making that migraine threshold low before the Lyme diagnosis ever came. It is not addressing the disrupted circadian rhythm, the electrolyte imbalance, the gut inflammation, the toxicity load, the chronic nervous system dysregulation that was already there. Chronic Lyme actually creates what I would call the perfect storm for migraine: the neuroinflammation, the immune disruption, the gut damage from repeated rounds of antibiotics, the sleep disruption, the elevated cortisol from the body being in a constant state of threat. Every single one of those things that I just mentioned is also a migraine inducer or a migraine driver, and they compound each other. So when a woman waits to work on her migraines until the Lyme is resolved, she is potentially waiting for something that takes years. And in the meantime, her migraine threshold, it's staying low. Her inflammatory load stays high. And her body is using whatever resources it has just to survive the daily head pain. That leaves barely anything left for healing. The body cannot heal from Lyme when it is simultaneously managing a chronic inflammatory migraine load. They're not two separate systems. This is one body trying to fight on two fronts with a depleted army. And that army needs to be supported, not divided. So here's the framework that I want you to take away from this episode. Reducing your systemic inflammation is not a separate goal from recovering from Lyme. It is the same goal. And when you bring your inflammatory load down, when you address the inducers that are keeping your migraine threshold low, you are creating a biological environment in which your immune system can actually do its job. You are reducing the neuroinflammation that the Lyme bacteria triggered, and you are supporting the gut that treatment has disrupted. You are calming the nervous system that has been in a chronic threat state, and you are freeing up resources from healing. The functional medicine approach is getting inflammation down and the immune system back in fighting condition before or alongside antibiotic treatment. The reason: the body needs to be healthy enough to respond and fight back. If not, there can be too many other chronic problems for the treatment and the immune system to work properly. That's the key sentence. The body needs to be healthy enough to respond and fight back. And when you're having multiple migraines a week, your body is not in a position to fight back. It's in survival mode. And survival mode and healing mode are not the same thing. So what this looks like in practice: getting inflammation down does not require waiting for the Lyme to resolve. The research and the clinicians who work most closely with Lyme patients consistently show that anti-inflammatory support running alongside treatment produces better outcomes than treatment alone. This means addressing what we call in the Freedom from Migraine method, the 6 keys in phase 1. These are the inducers. We look at electrolyte balance because mineral dysregulation directly affects both migraine threshold and immune function. We look at nutrition integration because the gut disruption from chronic Lyme and repeated antibiotic use makes this a non-negotiable. Circadian responsivity, meaning sleep and your body clock, because Lyme bacteria become more active when the immune system is suppressed by poor sleep. Mindset modulation, because that chronic stress response that comes with a Lyme diagnosis keeps cortisol elevated, and cortisol is a direct migraine driver. Toxicity mitigation, because the body's detoxification pathways are already overloaded. And movement, gentle, appropriate movement that supports lymphatic drainage without overloading an already taxed system. None of this conflicts with Lyme treatment. All of it supports it. When you reduce the inflammation, that inflammatory load throughout these 6 areas, you're not taking resources away from fighting Lyme. You are adding resources to the fight. Now, I want to tell you about Kim. Kim is a graduate of the Freedom from Migraine Method, and she gave me permission to share her story because she said she wishes someone had told her this was possible before she spent years waiting for permission to feel better. When Kim came to me, she had been dealing with daily migraines for over 30 years. Not occasional migraines, not frequent migraines, but daily at a pain level, when I met her, 8 to 10 every single day. It actually took Kim and I think it was 3, if not 4 times to be able to have a full conversation because her pain was so bad. She was like in a lounge chair with ice on her head and everything she could do just to try to get through a conversation with me. She had chronic Lyme disease, diagnosed fibromyalgia, an inflammatory muscle condition. Her muscles were inflamed and in consistent, constant pain. She had arthritis of the jaw joint, cervical neck pain with disc disease, irritable bowel syndrome, tinnitus. And when I look at that list, I do not see a woman with 7 or 8 separate conditions. I see a body that has been carrying a massive inflammatory load for decades. One root, multiple expressions. Kim had essentially been told, directly or indirectly, that her situation was too complex, that she needed to tackle each thing separately, that the Lyme had to come first. She had so many doctors and so many different pills and supplements and procedures and she's a nurse, and she could not keep track of what was going on. She had tried so many things and was really hesitant, but she came to the Freedom from Migraine Method anyway. It was her last resort. She worked on getting her inflammation down. She addressed the inducers. She did not wait to get that Lyme under control. And here's what Kim said in her own words. I want to read it so I don't mess it up. My migraine intensity has gone down from 8 to 10 to 2 to 4s. The barometric pressure no longer makes my migraines worse. I do not take any migraine drugs, not even rescue drugs. Getting my inflammation down has melted most of my body aches and pains. The Freedom from Migraine Method has been life-changing after 30 years of daily migraines. Now, at the time that I'm doing this podcast, Kim still has Lyme disease. She is still working on that chapter of her health, but her body is no longer drowning in the inflammatory load that was making every single day a migraine day. And because that load has come down, she is in a much better position to continue her healing. Now, I did a full episode with Kim and her husband. She tells her entire story in her own words, and it's worth every minute. The link is in the show notes, but if you need help finding it, just reach out. It's also on my YouTube channel. All right, I want to close this episode out with something I say very often because it matters here more than almost anywhere else. Your body is not randomly failing you. If you have Lyme disease and chronic migraines, and you've been treating them as two separate battles with two separate strategies and two separate timelines, I want you to consider that there might be one battle, one root, one inflammatory fire that is feeding both of them. And if you are someone who has been dealing with migraines that just do not behave the way a typical migraine, is kind of described, migraines that do not follow a consistent trigger pattern that show up alongside other symptoms like brain fog or widespread pain or fatigue that never fully lifts, pay attention to that. Not in a scary way, in a I'm curious way, because your body is trying to tell you something. And the symptoms are the message, not the problem. I say this all the time. Our body cannot speak English, but it is speaking to you every single day in your symptoms, in how you feel. It is not normal to be 40, 50, 60 years old and think that, okay, because I got older, now I'm supposed to feel all these horrible symptoms. No, it's your body saying, hi, I need help. I need you to pay attention. And the longer you don't pay attention and don't understand the language your body's speaking, the more your body's going to speak to you. Now, the work of getting your inflammation down, the work that we do inside the Freedom from Migraine method, it is the same work that supports your body in healing from whatever is driving that inflammation, Lyme included. When you address the inducers, you address the drivers. You're not choosing between conditions. You are supporting the whole system. And a supported system heals better than a divided one. You don't have to wait. You do not have to choose. And you do not have to stay in survival mode indefinitely while you wait for one condition to resolve before you start working on the other. All right, so if you have questions after listening to today's episode about anything that we covered or about your own situation, everything you need is in the show notes. Kim's full episode link is there, along with ways to reach out to myself or my team directly. And if this episode resonated, if you thought of somebody when you listened to this episode, please share it. There's a woman in your world who has a Lyme diagnosis and chronic migraines and no idea that these two things are connected at the root. Just send it to her. It might be the thing that changes the direction of her health history. I'll see you in the next episode.